Hello, I'm Dr. Travis Hunsaker with Hunsaker Dental, and today we're going to talk about dental implants. A lot of people think of the implant as the whole tooth. So there's like a tooth and the implant's all into the bone. It's kind of the done deal package. In the dental world, when we refer to an implant, the implant is the little part that is the screw basically that goes into the bone. There's three parts to it. The first part is what I just described. It's the screw that goes into the bone. There's a second part called an abutment. An abutment is a transitional piece that attaches to the implant and allows us to attach a crown or a bridge or something to it. That abutment is the second part. The third part would be the restorative portion, or the crown, or the bridge, or the denture. That would be the third part. So all three parts together make up what a lot of people call a dental implant. So just when you're researching dental implants, be aware of that there's actually three parts involved. And so a dental implant itself is the part that goes in the bone. There's an abutment that goes through the tissue, and then there is a final restorative part, albeit a crown or a bridge or whatever we're going to place on top of that implant. People always have the burning question: how much do implants cost? Now that you know that there's three parts to the implant, you have to be aware of what the advertisements are referring to. It varies. You got to make sure you're comparing apples to apples. I've seen a lot of advertisements for just the implant or the screw that goes into the bone. I also see advertisements for implants for all three parts. For us, the easiest way to kind of give you a ballpark on what to expect, if we're just doing an implant with a crown on top of it to replace a single missing tooth, that can range anywhere from about $3,000 to $5,000, depending at the beginning. It depends on a lot of things. It depends on how good the bone is. Do we have to do any bone grafting, which we'll talk about in another video. And so when you're doing your research and comparisons, make sure you're comparing apples to apples. Make sure that you're comparing for the implant, or is it for the whole thing? Because you should know that. Thank you for watching this video. I hope it provided some valuable information for you. Don't forget to like, comment, and subscribe to our channel, and let us know what videos you want to see in the future. If you have a question that you'd like to have answered, let us know in the comments below.